Hello dear fish keeper, dear aquarist. Welcome to my case 170 about the oranda. The oranda suffering from multiple diseases, multiple problems, and the videos which I show you and the explanation what I've been seeing will be interesting you to understand this complex fish disease. Yes, it's 170 cases already I've done, and this goldfish, a fancy one, was suffering from a mix of infections. In my books I explain a lot about medications and treatments that help you to keep your fish in better condition. And here we observe the fish in the tank, and you see some in between, the bigger ones, the healthier ones. There are some skinny ones, some weak ones in between. If you look closely, you see them swimming, not normally. You see one here, getting also skinny, getting black patches. And here we see another observation of the tank. Well, the fish had a bad history of stress. I'll explain it a little bit more later on because this was causing a problem. And here we pulled out a few, and that's the ones we examined. That's the weak ones who are dying. Look, they had some black pigmentation on their body. They have some necrosis. They had bad respiration. They were just dying. So we took a scraping, we took parts of the tails, and look at the skin flukes. Look at the worms moving around, and there are quite a few worms, of course. This will damage the fish, this will stress the fish, this will cause other infections to appear. See the worms trying to escape from the scale because they are in a stressed situation. When I take my scraping and put a glass on top of it, the worms want to get out. Those are skin flukes. And not only skin flukes, we see one here at the left, but look in here. You see quite a few of tiny, small flagellated parasites, Ichthyobodo, moving around into the water, into the fluid next to the scales. So we had a second parasitic infection. That's not only flukes, but also Ichthyobodo, called Costia. And then we saw the gills. The gills had bad necrosis. Look, that is, of course, makes the fish suffer badly. And internally in the organs, we saw the front kidney and the back kidney, both of them with a lot of pigmentation and back blood clots. So it's a bad kidney condition. Also, a lot of black pigments in the organs, next to the liver, next to the intestine, which is due to a stress condition that the fish were suffering from. And that makes the organs bad, makes the fish weak, and that's probably also why the parasitic infections appear. So they might have suffered the stress from a poor history of poor handling, maybe wrong medications. But that can happen if you put a wrong medication or a too high dosage. That can stress the fish. And it makes them prone to get skin flukes or parasites, Ichthyobodo, which are always a few around in the water. You cannot avoid to have it completely clean. And always a few, it's not a problem. But when the fish is weak, it can become an infection. And here also an antibacterial treatment might also be necessary. See my books, so to combine the treatments against the flukes, against the bacteria, and you have to help the fish to stimulate the immune system. And recommend for this Dr. Bassleer by Fish Food Forte. So the food and medication needs to be applied here for the fish. And some might be too weak to be handled with an extra treatment. So you have to realize that can be for some too late. Get my books to understand fish diseases. And this case helped you to understand the complex case of fish diseases. So you become and stay a better aquarist. Subscribe to my videos to learn more and follow my cases and like this video. Thank you for watching.